In this video, we are going to see about diabetes. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot use the insulin it produces. Insulin is a hormone that regulates blood glucose and it is generated by pancreas. Hyperglycemia, also called raised blood glucose or raised blood sugar, is a common effect of uncontrolled diabetes, and over time it leads to serious damage to many of the body systems, especially the nerves and blood vessels. Between 2000 and 2019, there was a 3% increase in age standardized mortality rates from diabetes. In lower middle income countries, the mortality rate due to diabetes increased by 13%. Types of diabetes. There are three types of diabetes: type 1, type 2, and gestational. Type 1 diabetes is also known as insulin dependent juvenile or childhood onset diabetes because it is characterized by deficient insulin production and requires daily dose of insulin. Type 2 diabetes affects how your body uses sugar or glucose for energy. It stops the body from using insulin properly, which can lead to higher levels of blood sugar if not treated. Over time, type 2 diabetes can cause serious damage to the body, especially nerves and blood vessels. A combination of several factors like broken beta cells, extra weight, metabolic syndrome, etc., are the causes of diabetes. Gestational diabetes is one that occurs for women during pregnancy. It is a hyperglycemia with blood glucose values above normal but below the diagnostic of diabetes. The women with gestational diabetes are at increased risk of complications during pregnancy and at delivery. These women and possibly their children are also at increased risk of type 2 diabetes in the future. Symptoms. Symptoms of the diabetes may occur suddenly. In type 2 diabetes, the symptoms can be mild and may take many years to be noticed. Symptoms of diabetes include feeling thirsty, needing to urinate more often than usual, blurred vision, feeling tired, losing weight unintentionally. Over time, diabetes can damage the blood vessels of eyes, kidneys, etc. People with diabetes have a high risk of health problems including heart attack, stroke, and kidney failure. The diabetes can cause permanent vision loss by damaging blood vessels in the eyes. Many people with diabetes develop problems with their feet from nerve damage and poor blood flow. This can cause foot ulcers and may lead to amputation of the foot. Diagnosis and treatment. Early diagnosis can be accomplished through relatively inexpensive testing of the blood glucose. People with type 1 diabetes need insulin injections for survival. One of the most important ways to treat diabetes is to keep a healthy lifestyle. Some people with type 2 diabetes will need to take medicines to help manage their blood sugar levels. These include insulin injections or other medicines. Along with medicines to lower blood sugar, people with diabetes often need medications to lower their blood pressure and statins to reduce the risk of complications. Additional medical care may be needed to treat the effects of diabetes. First one, foot care to treat ulcers that are formed in the foot, screening and treatment for kidney disease, eye exams to screen for retinopathy, which can cause blindness if it is untreated. Prevention. The lifestyle changes are the best way to prevent or delay the onset of type 2 diabetes. To help prevent type 2 diabetes and its complications, people should reach and keep a healthy body weight. Stay physically active with at least 30 minutes of moderate exercise each day. Eat a healthy diet and avoid sugar and saturated fat, and they should avoid smoking. Thank you.